5 months out from my surgery, and there's still not a minute of the day that I'm not thinking about my knee and aware of it, what's happening to it, and how it feels. The only time I'm not thinking about it is at night when I'm asleep. But I did think I was going to be a little further along in my recovery than I am now, but the acute pain is gone. I still have some achiness, and I ice it still, still some swelling in probably the whole leg, which I'm kind of surprised at, but I think the recovery process is much longer, and probably for most people, I won't say all people, but for most people,
We've had
difficult
kind of a group meeting, a support group before the surgery to meet with patients who have undergone the surgery. And there was an informational meeting that was about 3 hours long to tell you kind of what to expect in the hospital, and how to ambulate and how to take care of yourself after surgery. But they didn't talk about the long-term recovery process. And I feel like some kind of a meeting to discuss that would have been helpful, even to have my physician tell me a little bit more about what to expect, because it's kind of sugar-coated, and it's a pretty major surgery, and the recovery is pretty major.
So when you're discharged from the hospital and then you resume your activities at home, or you're at home for your initial recovery, you are given a lot of paperwork to go through as to your medications and what you should or should not be doing. And I found that I was not in a good position to review that paperwork myself, and I really didn't care about looking at it. And so my caregiver, my daughter, was the one who was in charge of my care for the first week after I came home. And when we had a question together, or she had a question, it would have been nice to have had contact with a nurse through an application that you could have sent an email saying, is this normal, is this abnormal, should I be concerned, my mom needs more medication, who should I contact, things like that for your caregiver would have been a nice thing to have had, because I wasn't totally with it all the time. When you're with pain medications and you're hurting, you just want to make the pain go away. You don't care about reaching out. So the caretaker needs to be able to reach out in your place. Some kind of an app would have been beneficial, that maybe if it's not possible for people to attend for perhaps a group meeting, that you would have seen or you would have heard someone talking about your recovery more extensively. And an application would have definitely been beneficial. I know that there are websites that you can go to, and their physicians are talking about your recovery, but I didn't actually see where a patient was talking about the recovery. And there are blogs out there, but an application would have been nice where you would have had different people perhaps explaining different aspects of the recovery, from the surgeon to physical therapy to your primary care physician, who has to assume responsibility for you once you're out of the hands of your orthopedic surgeon. So that definitely would have been beneficial, and I think it would have helped my mental healing process a little better if I'd understood what I was going to be going through.